We are here in Addis Ababa in Ethiopia on the occasion of the 35th Ordinary Session of the African Union Summit. Today we'll be receiving as guest Dr. Nkengasong, Director of the Africa Centre for Disease Control and Prevention. So the African Union, through the Centre for Disease Control and Prevention, has since the start of the COVID-19 pandemic put in place measures to curb the spread of the virus. This is seen through several programs aimed at boosting vaccination. So far, how have these efforts impacted the fight against the pandemic on the continent?
So far, the efforts of the Africa CDC, which represents the Commission's work, the African Union, has been, in my view, extraordinary in supporting member states, all 55 member states, to respond to this terrible pandemic. I always start by acknowledging the remarkable political leadership of the continent. When COVID-19 hit the continent in 2020, the chairperson of the African Union at that time was President Cyril Ramaphosa, who is the president of South Africa. And together with the chairperson Musa Faki, the chairperson of the African Union Commission, the two of them played a very critical enabling role in allowing Africa CDC and supporting Africa CDC to really put into place several initiatives, including access to vaccines, including increasing testing across the continent, and so many initiatives were put together because of the strong political engagement. The African medicine supply platforms are all instruments that were put in place by the African Union Commission under the strong political leadership to fight the pandemic in Africa.
What lessons can Africans learn from the COVID-19 pandemic so as to prevent future health crises?
So there are two categories of lessons that Africa as a continent must learn from this pandemic. The first is that through the power of cooperation, collaboration, coordination, and communication, by agreeing to work under a joint continental strategy led by, at that time, President Cyril Ramaphosa, was very effective. So I always say that is the power of unity has actually prevailed. I always also add that that means that regional institutions like the Africa CDC and now the African Medicine Agency that has been launched are critical for our overall health security and must be supported. I think that is extremely important. Without that coordination, collaboration, and communication, and strong political leadership, the continent would have fallen apart. I think that is a lesson number one. The second category of lessons that is what I call the gaps that existed before the pandemic. Maybe the best way to characterize that is what I refer to as the knowns do nothing gaps. This increased for our understanding that as a continent, we imported onto this pandemic 99% of our vaccines. So we relied on the external world to guarantee our vaccine security. That before this pandemic, absolutely no country on the continent was producing diagnostic tests. And those are severe vulnerabilities that we learned from this pandemic, that we saw that at the start of this pandemic, we'd have limited access to diagnostics. We saw that when vaccines were available, we had limited access to vaccines, and those are lessons that we must learn. But I'm very encouraged that now it's about 3 or 4 countries are now producing diagnostics, that there are about 10 countries that are now gearing up to producing vaccines across the continent. So the way we perhaps fight the next pandemic will be very different from the way we fought this pandemic.
So given the new variant Omicron with the 4th and the 5th wave of the virus reported in many African countries, how can Africans learn to live with the virus like any other virus while still keeping their economies thriving?
So there's a common understanding that we have to do 4 things to fight this pandemic so that we can at least restore certain level of normalcy. I will hasten to say that it will be false expectation to believe that we'll go back to life as it was in 2019. So the 4 things include, if we scale up vaccination quickly, and engage the youth population to actually play a critical role, because remember, more than 70% of our population is less than 30 years. So it's a continent that is driven by the youthful population. If they take an active part in scaling up vaccines, if we roll out testing and make sure that we democratize testing so that everyone in a household who wants to be tested can get their testing, can actually do it themselves, what I call self-testing. If we say we work hard to increase access to treatment, the drugs that like Paxlovid, so that if you test positive, you can actually, and you're feeling sick, you can actually take your drug. Then we continue to wear a mask in public places where you meet a lot of people. Then there's a chance that by the end of 2022 and 2023, we may begin to get to some level of normalcy there. I think, again, it's an appeal to the population that we should have what I'm calling sign a social contract with ourselves. That says that we will do those things that I just listed so that we can come out of this pandemic together.
So as of today, what's the vaccine situation on the continent, and what is the African Union doing? What strategies has the African Union put in place to boost vaccine manufacturing on the continent? So
as we speak today, about 11% of the population have been fully vaccinated in Africa. That's where we are. Remember, our target is to get to 70%, to enable that we get that level of population vaccination. And some countries are making very good progress. Morocco is at about 62% average vaccination. South Africa, Egypt, Mozambique, Rwanda, they're all making progress. So we are very encouraged to see that quite a good number of countries are moving towards that direction. Remember, our target is 70%. So unless we get to 70% collectively, a threat in any one country will continue to be a threat in all countries in Africa. So we have set up, in terms of strategy, the African Vaccine Acquisition Task Team, which was set up by President Ramaphosa, is headed by Mr. Strive Masiwa and supported by Dr. Vera Songwe, the Executive Secretary of the United Nations Economic Commission for Africa, and the President, Benedict Orama, the President and CEO of the Exim Bank. And on that note, I would actually say that the Exim Bank, we owe them a lot of acknowledgement for the remarkable, bold leadership that they played in looking for $2 billion to enable the African Vaccine Acquisition Task Team to acquire 400 million doses of vaccines. Africa should be very proud of that initiative. It is the first time in the history of the fighting diseases on the continent that we saw the continent come together, mobilize their own resources to acquire 400 million doses of Johnson & Johnson vaccines. If you translate that into the double doses of vaccines, like the other vaccines, it means we acquired almost 800 million doses of vaccines. About 10 countries have now engaged in the journey to manufacture vaccines. They include Egypt, Morocco, Rwanda, Senegal, South Africa, Nigeria, Kenya, Ghana, Algeria, I did mention. And we are very encouraged to know that Egypt is now producing about 3.5 million doses of vaccines. That is the fill and finish. And they're working together with the Chinese. We just heard this week that the King of Morocco has launched a large vaccine manufacturing that will not just produce COVID vaccines, but other vaccines. Senegal has also engaged in that process that they will manufacture COVID vaccines, but other vaccines. And many other countries. South Africa is already producing vaccines for COVID. The Johnson & Johnson vaccines are produced right there in Port Elizabeth, and I was there to actually see the production. And the Biovac in South Africa is a company that is also going to be producing the mRNA vaccines, and Rwanda and Senegal very soon. So again, very encouraged. And I always say that the way we fight this pandemic with respect to access to vaccines will be very different when we are challenged with another pandemic. I really hope that there will be no subsequent pandemic, but the way that viruses evolve and the way that the world is evolving, there's no doubt that there will be another pandemic. But Africa will be fighting it very differently from the way we are fighting this pandemic.
Well, Dr. John, tell us, with many African countries, efforts put in place by African governments to start producing vaccines on the continent, why is the vaccination situation not still stable on the continent?
The vaccination position is improving on the continent. If you recall last year, I mean, the continent had very limited vaccines. They're coming in. Now, when a country engage in vaccine production, you don't start getting the vaccines the next day. You have to build a factory, right? You have to look for the raw materials, okay, to produce the vaccines. And then you have to put in that production lines. It takes time. If you want any speculation, I'll say by the end of this year and early next year, many more countries will be producing vaccines, and you have more vaccines on the market there. But you have to give them time, because vaccine production is not like you go to the shop and buy a product. You have to actually build the physical infrastructure. You have to develop the human capital that will be required, and you also have to have the production ability for that vaccines.
So Cameroon is currently hosting the African Cup of Nations 2021. Measures have been put in place to curb the spread of the virus. One of them being mandatory vaccination to access the stadium. But this measure seems not to be respected by many supporters. So in your opinion, what can make the population actually accept the vaccine given the advent of new variants in African countries?
First of all, I must congratulate the organizers of the African Nation Cup for the partnership with the Ministry of Health of Cameroon and the Africa CDC and the MasterCard Foundation under the Saving Lives and Saving Livelihood initiative. We have a team in Cameroon that is supporting the ministry to do daily testing, that is supporting the ministry to scale up vaccination at all sites, okay, including access to the stadium. So again, we are learning, when I mean we, the collective we are learning how to manage this virus, at the same time save lives and save livelihoods. The organization of the African Nation Cup is a good example of managing our economic activities, social activities, at the same time protecting lives. And we will learn from it. There are lessons that will be learned so that the next time another big event is organized in Africa, we are probably better prepared. But we needed to start somewhere. And the information I'm getting from the team that I have in Cameroon is very encouraging, that vaccination rates are increasing, the testing is going on daily basis, and the verifications as much as possible. We never expected 100% compliance, that everybody will comply, but in public health, as we say, you go to war with what you have and not what you want. So we'll learn lessons from it, improve, and continue to build on that as we plan for subsequent activities.
Thank you for following this interview with Dr. John Nkengasong. Information continues on Africa 24.